Good morning, everybody, and welcome to a very special edition of AM Buffalo. I'm Linda Pellegrino. Being that we're just weeks away from Breast Cancer Awareness Month, we want to help save lives by helping everyone stay informed about what they need to do and to discuss mammography and why it is so important. So for this, we have Dr. Ermelinda Bonaccio, who is the chief of the Breast Imaging Center at Roswell Park Comprehensive Cancer Center with us, and we have a very special 30 minutes to talk about this. So good morning, nice to have you back.
Thank you for having me back. It's my pleasure.
Let's talk about mammography. What exactly is it?
So a mammogram is a type of x-ray that looks at the breast tissue to find cancer, hopefully when it's small, and more likely we can treat it, lower the risk of dying from breast cancer, and treat it with less aggressive treatments, more likely to have a lumpectomy rather than a mastectomy.
All right. Who should get a mammogram?
So women at average risk should begin annual screening mammography at age 40. There are some women who are at higher risk that may have to start at a younger age, but that should be done in consultation with their physician.
Right. Why is it so important?
It is the only test that has been shown in multiple clinical trials to lower your risk of dying of breast cancer. The range is between 20 to 40% reduction in your risk of dying from breast cancer.
How often then, after that initial mammogram, should they continue having mammograms?
So this has been very confusing for patients because different organizations have recommended different ages to start and how often you should have a mammogram. But the bottom line is, yearly mammography beginning at age 40 saves the most lives. That's when you maximize that mortality benefit.
Now, if you have someone in your family, you have a mom or a sister who had breast cancer, you're going to be most likely told, start getting them sooner.
Yes, especially if, like you said, exactly, a mother or sister will typically, especially if the family members are premenopausal, we will often start about 10 years before your mother was diagnosed or your sister was diagnosed. So if your mom was diagnosed at age 42, we would start at age 32. We usually don't start younger than age 30, and there are other patient populations that might also start at a young age. So it's really important, if you suspect that you're at high risk, to talk to your doctor, to possibly go to one of the high-risk clinics. We have one at Roswell that will give you a full assessment of your risk and then help you figure out when you should start having a mammogram and how often.
We talk a lot about mammograms, and there are some women who are afraid, thinking that if I go and have a mammogram, they'll find something, and that's not what I want to hear. It's important to understand most lumps in the breasts are benign.
Right, exactly. Most women who get a mammogram are normal, but this is an opportunity where we can make a difference. If we can find a breast cancer early, you're more likely to live and also get less aggressive treatment.
Right.
You may not need a mastectomy, or you may not need chemotherapy. So I think it's important to know that most mammograms are normal, but if there is a finding, if there is a small cancer, there are a lot of options for treatment of breast cancer, and we do very well with breast cancer. Most women who have breast cancer live.
They do fine.
Yes.
We also would like to tell you there's more tools at the ready than ever before, even with mammography. There is 2D and now there is 3D, which Roswell Park does have, and we're going to be talking about that. So what we're going to do is take a quick break. Dr. Bonaccio will stay with us. When we come back, we're going to continue this conversation with why you want to get your mammogram at Roswell Park. So stay with us. We are back with our special edition of AM Buffalo, all about breast health and what you need to do to stay healthy. My guest this morning, Dr. Ermelinda Bonaccio, the Chief of Breast Imaging, the Chief Let me do this again. I don't want to screw that up.
Where am I looking?
You're going to look at me.
Okay, good girl.
Yeah, we're just going to start that
Okay,
tape again.
so much easier.
Okay, here we go. 3, 2. Welcome back, everybody. We're back with our special edition of AM Buffalo, all about breast health and what you need to do to stay healthy. My guest this morning, Dr. Ermelinda Bonaccio, the chief of the Breast Imaging Center at Roswell Park Comprehensive Cancer Center. She is here with Mary Lou Ozarzek, who is a breast cancer survivor. And we're going to talk a lot about mammography, the tests that you're going to take, what if something is positive, and we're going to go from there. So welcome back, doctor. Welcome, Mary Lou.
Thank you.
Mary Lou, let's talk about something that has happened to women like yourself. You had a normal mammogram and felt lumps, what, 2 weeks later?
I did. I had a mammogram. Actually, it was not so quite normal. It was, there were some suspicious things going on. And so they did call me back, and I was there for about couple more hours. I went back, and they said, we'll check you in 6 more months. Everything looks okay. We're going to check you in 6 more months. Literally 2 weeks later is when there was another lump that I found in a different area than they had originally been looking at.
And what's important, doctor, is that she went right back and made that phone call. You don't wait and say, well, I had they told me 6 months. If you feel something new, you go back to the doctor.
Exactly. Mammogram is a good test. It's the best test we have for finding, for average risk women to find breast cancers, but it is not a perfect test. So I often say, if you feel a lump, I actually usually use 2 weeks after a mammogram that's normal, you still have to have it evaluated because there are cancers we just don't see on the mammogram.
Now, if you are due for a mammogram, you can have yours at Roswell Park. You don't have to be a former patient to do that. They have a whole floor that is dedicated to your comfort and getting the very best technology and the very best resources and doctors to take a look at those mammograms.
Yes, the Roswell Park Breast Imaging Center is now open to the community. You don't have to be a patient to make an appointment to have your mammogram. You don't have to enter the hospital. You can just enter the building the Breast Imaging Center is in. And we really hopefully have created a space that's very calm and doesn't feel like a hospital to have your mammogram.
Plus the very best tools, as I say. 2D is what has been the norm. You now have 3D mammography available.
Yes, we have 3D mammography, which is I describe it as a better mammogram. It's been found in multiple studies to be able to find more cancers. So it increases our ability to find breast cancer, and also it lowers our recall rate, meaning it lowers the a false positive rate, the number of times a woman has to come back and have any additional imaging after that initial 4-view mammogram. So it is a better mammogram, and that's why when we moved into the Clinical Science Center in 2016, we converted completely to 3D mammography.
Even with a 3D mammography, when do people find out their results?
So you have an option if you come to Roswell. You can wait for your results and get the results the same day. But we also realize that many women are very busy. They're working mothers. They just are taking care of everyone else. So we have an option of an express appointment, which takes literally 30 minutes. And but you don't get your results right away. We'll call you the next morning. Most mammograms, as we talked about earlier, are normal. So we'll call you the next morning. If it's normal, you're done. You've gotten your yearly mammogram.
Right.
If not, if you do need to come back, which is usually only about 8% of women need to come back for any additional pictures, we'll get you back right away.
Mary Lou, you went ahead and had a mastectomy.
I had a lumpectomy.
A lumpectomy, and before you know it, you were already riding for Roswell.
Yes. I was 5 days after my lumpectomy, and I had been determined to do my first ever ride for Roswell. I had signed up at the beginning of the year, just as Mary Lou, and then I was diagnosed with cancer, and I told my doctor I am supposed to be riding the ride for Roswell this weekend, or that week when she decided to do the surgery, and she said, I have no restrictions, I put no restrictions on my patients, so if you feel up to it. So 5 days after my cancer surgery, I rode 20 miles in my first ever ride for Roswell, and it was stunning.
That's important. There's for so many breast cancer survivors, there's a lot of future. And that's what's important, and that's why we're doing this show today. To find out, to be forearmed is to be forewarned, right? Dr. Bonaccio, Mary Lou, thank you so much. Listen, everybody, when we come back, we're going to talk with a Roswell surgeon about what happens if a lump is found, so stay with us. Welcome back to our very special show about mammograms and how important they are to your good health. This morning, we're going to follow Dana. She's on her way to Roswell Park to get her annual mammogram. Take a look.
Today I'm driving to Roswell to get my mammogram. This will be my 4th mammogram.
She's an actual patient, and we will be filming her as she goes through the process of having her mammogram here today.
I chose to do this mainly because I know of the importance of getting a mammogram.
The annual screening mammography is the only test that has been proven in multiple types of trials to lower your risk of dying from breast cancer.
Today's probably a little bit more, I guess, emotional, just because last year in June, my husband was diagnosed with breast cancer, and he went ahead and had the mastectomy. He went through chemotherapy, 16 treatments, and he's currently in radiation. I know that it can actually happen to us. Breast cancer does not discriminate.
We do not know the results of her mammogram. We'll only know once the images are obtained, but of course we're hoping for good news. Most women who get a mammogram are normal. Only about 8 to 10% will even need additional imaging, and a very small portion of those women will need a biopsy.
I've always gotten a script from my gynecologist, and on this prescription there was the name of the facility that they wanted me to go to, and I was to call that facility and make my appointment, which I've always done. But it wasn't until I found out recently with Roswell that I can choose to go any place that I would like to for my mammogram, maybe a closer location or just a place that I may be more familiar with or comfortable with. That was something I never knew. I thought I had to go to the location that was on the script that my doctor gave me. I guess there's a comfort knowing that if something does arise from the mammogram, something shows up, that the experts are there. I mean, they're on the front line of the latest technology and the newest information in regards to cancer treatment. I guess when you hear the name Roswell Park, you automatically associate it with cancer, and rightly so. It's a cancer research center. But I guess I was under the assumption that you would only go there if you had cancer. But it makes sense that they would offer mammograms. I just guess I never put the two and two together, but it makes common sense. Hi. How are you? I'm good. I'm Dana Everett. I'm here for an 11:30 mammogram.
Okay. You to fill out, this is just telling you your breast health. And then this is consent to do the treatment.
Okay.
And then this is race and ethnicity.
I'm feeling pretty good. A little bit anxious, but doing okay. Typically, I am not nervous, but considering a journey that we've been on with my husband being diagnosed with breast cancer, I am a little bit concerned this time. Just not wanting to have anything show up, and having 3 daughters. I don't want both parents to have had breast cancer, so a little bit anxious, but Hi, I'm Dana.
Nice to meet you.
Nice to meet you too.
How are you doing today?
I'm doing good.
Good. Come on back.
It's beautiful. It's so relaxing and just kind of that homey feel. Everybody's so nice. So yeah, it's a beautiful facility. I think it's just you kind of feel very vulnerable because not only are you not clothed, I mean, you are wearing a robe, so they make you feel comfortable that way, but I think it's just the unknown. It's the fear of the unknown, and what am I gonna walk away a different person than when I walked in here.
Alrighty, you can come on over here. Have you ever had a 3D mammogram before?
Not that I'm aware.
Not that you're aware of. Okay. So it's a little bit different than the regular 2D mammogram. The benefits of 3D mammography is that studies have shown that it has found more cancers. Okay. And it also reduces the rate of patients getting called back for additional imaging. Okay? Yep. During the pictures, I will tell you to stop breathing twice. Okay? You do not need to take a deep breath in though. And your job is just to hold nice and still for me, okay? Yep. Okay. All right.
I feel like it was a piece of cake. It wasn't painful at all. The technician was great, made me feel very comfortable, did not take my breath away. I did not need a drink beforehand. So I believe I'm going to go into a room and wait for the doctor to tell me my results.
Women have the option of waiting for their results, or they can actually decide to leave after the initial mammogram is obtained, which would take less than 30 minutes, and get the results that next morning with a personal phone call.
It might not be the greatest experience that you want to go through, but on the other hand, not finding something and not having an annual mammogram, I feel like the consequences are too great. Things can change on a moment's notice, so I'm just anxious to hear the results.
We pulled up her images from today, which are in the middle, and we have her prior films, and it's very important in mammography to compare to the prior films, and we're able to do that very easily. And what we're looking for is any change from the prior years, specifically any lump or calcium deposits have developed. Lumps can be many things that are benign benign. They can be cysts or other benign growths, but what we have to make sure is that they're not cancer. So her mammogram is normal, so let's go deliver her that good news. Dana?
Yes.
Hi, Dr. Bonaccio again.
Hi.
Why don't you come with me into our room? So good news, your mammogram is completely normal, okay? And you don't have any family history of breast cancer, correct?
No.
Okay, so our recommendation is starting at age 40, you should have a mammogram every year. I saw that you've been doing that, and just you should continue to do that, okay?
Okay, yes.
Do you have any questions at all?
I don't think so.
Okay.
That's it, yeah.
Okay, you have a good rest of the day, okay? Alicia will show you how to get out of here.
I think that if we're not taking care of ourselves, we then can't really take care of our family. Whether it's through physical exercise or maintaining your health, even taking the time to educate yourself. Yes, and I'm hoping to make my appointment for next year.
Absolutely.
It can only benefit your family. You need to take the time, because the alternative to not and then something happening down the road, early detection is just key.
Welcome back to a very special show from Roswell about your breast health. What factors make women more at risk to get breast cancer? Our Courtney Corbetta speaks with Dr. Helen Cappuccino back at the hospital.
This morning, we take you to Roswell Park Comprehensive Cancer Center, a place where they offer a variety of services to keep you informed when it comes to your health. This morning, breast cancer surgeon Dr. Helen Cappuccino joins us, and we're going to talk about the breast cancer risk assessment and prevention program. Dr. Cappuccino, thanks so much for having us.
Hi, good morning. How are you?
Why should women make this a priority? Make this program a priority?
Obviously, it's pretty important to assess your cancer risk so that we can prevent it if at all possible, and certainly detect it at the earliest possible stage so that women can survive breast cancer. Obviously, one of the mainstays of the program is screening, and we can do that with our mammography program. It's a very convenient program here at Roswell. Anybody from the community can come and have their screening done here. I have my own mammograms done here. For women who are at increased risk, there are some additional screening modalities, including MRI and ultrasound, and we have a terrific expert group of women that are reviewing those films to make sure that we detect anything that happens.
Just say you come here to Roswell Park Comprehensive Cancer Center and you go through the program and unfortunately something is found. What's the next step that a Western New Yorker should take?
That's a good question, and people come here in a lot of different ways. They may come in through the program, they may be referred by their primary care physician or their gynecologist, or they may self-refer because they feel something. But obviously an important first component is getting that imaging done to see what is on the mammogram or ultrasound or MRI, depending on what studies have been done. And then occasionally a biopsy will be necessary. More often than not, the most appropriate biopsy to be done is an image-guided biopsy, where they put a small needle in after numbing up the breast tissue and take a sample of what it is that they're seeing or what it is that you might be feeling, and then it's sent for analysis. It'll be reviewed by a team of pathologists that specialize only in breast, and based on the findings, either they'll recommend a 6-month follow-up or a yearly follow-up or a consultation with somebody like me who is a breast surgeon. And if it's something that needs to be removed, that's a small operation that can be done here at Roswell to remove it and get a definitive answer or to treat it.
If you're meeting with your primary physician and he or she sends you here, should you bring anything with you?
The most important thing, besides obviously all the necessary paperwork, is really just a good history of what you've experienced. Did you feel anything? Were you having any pain? Does it vary with your cycle? Is there any nipple discharge? Tell us about the lump, how long you've had it, what makes it better, what makes it worse. Is there pain? Are there any other lumps? Is there anything else you noticed with the skin? Any of these things a good doctor should elicit in your history and physical when you're meeting with him or her.
Women in the Western New York community, they can come here to Roswell Park.
Not only can they, but I think they should. They have a great program here. Myself, my mom, my sister, everybody that I love and care about comes here for the breast care. And I like to think we do a great job of taking care of patients the way that I would of my own family.
For those women who are nervous about coming in and getting tested or going through this program, what would you say to them, going through all this yourself?
Sure. Everybody's nervous. Don't let anybody tell you otherwise. There's always a little bit of anxiety. Even if you're going for a very routine mammogram, there's always that concern that something might show up. But there's nothing more elevating that'll lift you up than having the mammogram done and finding out that it's clear. And if something is found, this is the place to be to have it worked up. We've got the experts here.
Thank you so much, Dr. Helen Cappuccino. You heard her. This is the place to be here at Roswell. All you have to do is come in and take that first step. Thank you so much. Now back to you, Linda.
We would like to thank everyone who joined us this morning with this essential information to protect ourselves and our loved ones from breast cancer. If you would like to schedule a mammogram at Roswell, visit roswellpark.org/mammo, or you can call 1-800-ROSWELL, 1-800-ROSWELL. Thank you for joining us. Have a great day and stay healthy.